Hi, so this is Nadia with Middleton Meyers. I'm the digital content producer.
You're speaking with Daniel Prah-Ennin, currently a retail pharmacist.
Well, nice to meet you, Daniel. Can you break down how your job prepared for the coronavirus before it started to spread widely?
So currently we've taken a lot of measures to pretty much break down and prevent the spread of the coronavirus right now. We've implemented cleaning measures. Every time the patient comes through, we are cleaning the common stations that they come through, the drive-through or the pickup areas or the drop-off areas. We are consistently doing that on the hour and every hour, wiping down, sanitizing all those areas. We actually trying to encourage more people to use the technologies that we have available, which is a CVS mobile app. So currently we have more people. We encourage more people to download that app because it has a pickup feature on that app that allows you to come through the drive-through or just to come through the pickup. Has that express pickup feature on there, or we do a scan it, pulls out the information. We got the script for you, and you pretty much if you do the express, you can prepay. So by the time you come, all we do is scan it and give you the product. So that's effortless, so you don't have to touch any of our devices and to pay or to sign for. You pretty much can sign on the phone app also.
Okay, so I'm guessing even with that, say if a person is sick, what would be the procedure? Are we able to get our medicine shipped to us, or what is another route for us to be able to get our medicine?
The free delivery is a 1 or 2 day delivery that comes to your house. It's pretty much shipped to your house. It's mostly picked up by the U.S. Postal Service. So they come get it and they'll deliver it to your home.
So the fact that it's allergy season going on right now, what are some symptoms that I guess we should be aware of? So there is a difference between allergies and the coronavirus.
What we are seeing mostly now is people with allergies. But right now what we're looking for, you basically need to look out for these symptoms like fever. We're looking at fever if you have fever, shortness of breath, and like a lot of dry, excessive coughing. But as far as the allergies are concerned, you're going to have scratchy throat, runny nose, watery eyes. Those are more symptoms for the allergies. And you still may experience some dry cough with the allergies, but as far as the COVID-19 coronavirus, we're mostly looking at 3 symptoms. First symptom is like fever. If you have a fever breaking out, we definitely need to get seen or tested.
Okay. And I guess that'll be also the difference between the coronavirus and also the flu, the hard at breathing, correct?
Yes.
Okay.
Yes, hard time breathing, just shortness of breath. I think it's more of a severe symptom.
So what has it been like at the pharmacy since the surge of the coronavirus has come to play?
Well, currently we've had a lot of people wanting to fill their prescriptions, so that's been a surge. And this is allergy season, so we've seen an influx of prescriptions for allergy medications. So we're filling a lot of those currently, but right now it's still business as usual. We just have the influx of just people wanting to fill their prescriptions early currently. So that's what has been overwhelming the pharmacy right now. But we're trying to make sure that we are well staffed to accommodate all that demand.
What are some of the stuff that you see customers coming into the store buying since the surge of the coronavirus?
Mostly, we get a lot of questions about thermometers. People want to get that thermometers just to make sure they have that at home, and I think it's been a high demand for that right now. Alcohol, there's been a high demand for that, and also people ask for masks and gloves, and most pharmacies do not have them in stock. But I mean, as long as people are patient, it's always going to come in, and it's been delivered. The supply comes every week, so we just need to come at the right time, and we'll have it available.
Have you ever experienced anything like this before?
No, I have not. That it's not in my. I've been in the pharmacy business for like 15 years now and never experienced anything like this. I do recall there was an epidemic for I think that H1N1. So that was like influx a lot of prescriptions for the flu. I think it was Tamiflu around that time. So I think that was the time we remember seeing an epidemic. But this one, I mean, this pandemic is I've never seen that or experienced it before.
Sure. I think that's probably a lot of us. What are you doing for yourself and family to prevent the coronavirus?
I mean, right now we just taking the same measure to protect ourselves, washing our hands, making sure that we're using hand sanitizer, staying 6 feet away from the next person. Just also when I come back from work, I just come home, wash my hands, sanitize everything before I even come around my family, because I'm in the pharmacy and they're always around people, so right. You got to take all those measures to protect your family, yourself and your family. So and that's what I do. I just make sure that I come home, sanitize. I have like a sanitation area. I come and drop off everything that I have on and take care of and wash my hands before I come into contact with anybody else.
For some of our residents, can you give them some advice and encouragement as we're all dealing with this in this crucial time?
The advice right now, if you don't have to go anywhere, just stay at home. And if it's essential, you have to go get something to eat, because I know people, you gotta eat something. Just make one trip, get whatever you need, and come back home. Make sure you remember to stay 6 feet away from the next person or around each. Don't be in the group. But you can still go outside. You can still go outside and walk. And just as long as you're social distancing, I think you'll be fine. Right now, we just want to really prevent that huge curve. We don't want a huge number of people to have this or to develop this virus. The less people we have infected, the more we're able to manage that and keep everybody safe and save people's lives. Because right. If we continue to go out and get infected, and it can definitely overwhelm the healthcare system. Right now, the healthcare system is overwhelmed and really unprepared for this pandemic. This will pass. This is a very aggressive measure to prevent that. But there is going to be a time we're going to get back on our feet and everything's going to go back to normal. We just have to do our part to make sure that our loved ones don't get this virus.
Do you have anything else? Any other words for us, Daniel?
No, just make sure that everybody stay healthy. If you're at home, just enjoy watching some Netflix. Enjoy some time with your kids if you have kids, and just make the best of it right now. I always think that going back to prayer. I think this is more than ever. This is the time we need to see God, to make sure that protect us and our family. And so this will be a good time to do that, to actually get closer to family and God.
That is correct. Well, thank you so much again, Daniel.